はい。
これで出てますかね。
どうでしょうか。まだ出てこないんですけど、僕の画面で。
だいたい30秒ぐらいですよね。
そうですね。20秒から30秒ぐらい
だい
で。
たいそんぐらいですよね。
あ、携帯はブーってなっていましたね。じゃあ、携帯は出てるんですけど、iPad が。
またあれいきますか。
どうでしょうか。まだ出てこないんですけど、僕の画面で。
来ましたか。
はい、来ました。で、僕
こ
の音は
れまた
大丈夫
いきます。
です。
これだいたい30秒ぐらいですよ
で
ね。
も良かったですね。もし先生差し支えなければ。
あった方がいいです。
あった方が、
WhatsApp で
え、
リアルタイム。
えっと、どうですかね。リアルタイムであって、良さがちゃんと感じました前回。
まあ多分じゃあ一応かけますね。
はい、わかりました。
はーい。これ見えますか。
はい。今、
これどうですか。
もうちょい左。完璧です。Alright, let's get
OK。
started. Good. ケンジ、音ちょっと落としてくださいね。携帯の方の。
はーい。
Ladies and gentlemen, good evening if you're joining us from Asia, good afternoon if you're joining us from Europe or Africa, and good morning if you are joining us from the Americas. Welcome to Kenji Ojima's YouTube Live International, our 11th episode. Ladies and gentlemen, we've done it. We are over 10,000, well over 10,000 views. Makes me feel good. I'm sure it makes Kenji feel good. By the way, if you don't know me, my name is Robert. I will be your host and MC on this hour-long journey of learning. And joining me, as always, the man of the hour, the star of the show, world-famous Invisalign, Black Diamond provider, and just a really good guy. Kenji Ojima. Hello, Kenji. How are you?
Hello, thanks a lot all the time, Robert.
You're very, very welcome. Kenji, we have over 10,000 views. How do you
Wow,
how do you feel about that?
amazing. That is amazing because initially, so the Robert and I is talking about twice a time per weeks, but we are connection to the over the world in internationally friend and colleague is a 10,000, right?
Yeah,
Wow,
10,000. Yeah,
thank
it's
you.
amazing.
Yeah,
It really is. Thank you. It really it is touching and it makes us feel very good. We are doing this because we want to share something, and the fact that you find value in it and come back to view it every week is something that is very special to us. By the way, if you're joining us for the first time, please take this opportunity to hit that subscribe button, hit that like button. Hitting subscribe helps us grow our channel. Hitting like helps other people like you find us so we can build a bigger community down in the live chat. Please hit that like and subscribe. So there's been a lot of change in the world recently. Things are not only the weather, but the coronavirus situation is changing.
yeah.
In Tokyo in Japan, it looks like we may have our state of emergency removed next week. We hope. Many countries around the world are in a similar situation, and I know that right now people are getting impatient. Okay, they want to return to their lives quickly, right? Speed is the name of the game right now. And in today's cases, we are going to be talking about speed as well. Today, we have two new cases for you, new for the show. Both cases are cases that have been presented in the Journal of Clinical Orthodontics, and both of which focus on speed. We're going to be looking at accelerated orthodontics, specifically with photobiomodulation, orthopulse, and seeing how they use can be used to decrease treatment times and accelerate results. In both cases, there was a time limit, a time constraint, and in both cases, amazing results were achieved. But don't believe me. Watch the case yourself, listen to Kenji, and be amazed yourself. So, as always, today we're going to be conducting a live interactive discussion of these cases. The live chat is open. We can see anything you say to us. So if you say hello, if you say, please tell me this or please tell me that, we are able to interact with you real time. So if you have anything you'd like to say to us, please do. So, Kenji, without any further waiting, let's get started with our first case. What is our first case?
Yeah. So before going to my case, I want to thank Lazan and Philas. Hello, thanks a lot. So now we're going to start it for our initial case, right? Okay, just hold on. I'm control this view, going to close. Okay. So initially, okay, let's go. So before going to start, Spa Max. Thank you.
Spamex 4.
Spamax 4.
Ooh, this is going to be, yes, actually, it is because Kenji uses various different accelerated devices, but he's able to achieve the results that you'll see today because of photobiomodulation.
Okay.
All right, Kenji, take us to our first case.
Okay, so going to initial case. So this patient is, our team is published on Journal of Clinical Orthodontics 2016. So this is the first article in the world using photobiomodulation with Invisalign system aligner orthodontic, 3 days aligner change, the faster orthodontic treatment for the aligners. Okay.
So Kenji, can I ask you?
Okay.
2016.
Yes.
This is the first article published about aligner orthodontics and photobiomodulation. So photobiomodulation is a very recent technology.
Mm-hmm. Yeah.
Okay.
Very recent. But photobiomodulation combined to the multi-bracket is published on 2015. So my friend is a publication, the JCO article. But this article is first in the world for the aligner orthodontic using photobiomodulation acceleration approaching. This title,
very exciting.
Thank you. Invisalign treatment accelerated by photobiomodulation. Our team, my name is Kenji, and Dr. Chisato Dan, Dr. Kubangai Yuriko, and my mentor, my master, Dr. Bernard Shoup. Our team published on this article on the JCO 2016. If you have an interesting, please read this one. So this article main topics is 3 days aligner change. This device name is OrthoPulse device using for the patient every day per 10 minutes in the house. Upper 5 minutes, lower 5 minutes, then so photobiomodulation effect. And this is a very important thing for the human body, is turnover, is a blood supply is change for the easy to move for the root, then we can do aligner change more faster. This is the initial situation for this patient. The chief complaint is high canine, anterior open bite, and upper and lower narrow arch. 41 years old female patient come to my office. Then so that this patient don't want any other braces because that this patient is a very famous, the beautiful ladies. That she don't want for the any put on the braces. Then so that she asked to me, can I do the cosmetic braces approach? Then I recommendation aligner is much better because very cosmetic. Then so that, and another reason for this patient is that she want to more faster. Then I recommendation for the photobiomodulation for the 3 days aligner change. Then the patient is accept for my treatment planning using aligners, using for the photobiomodulation 10 minutes per month, 10 minutes per day. Then the 3 days aligner change, and then started to this patient treatment. Initially, like this patient, I all the time talking about for this my YouTube channel. very important thing for the digital orthodontic treatment is based on the facial midline and based on the horizontal line. This article published by Vincent Kokic, very nice article, 2011. The facial midline is often the starting point of the dental aesthetic evaluation. That is very, very important thing for me. Then please have a look. The left photo is the initial situation. The right photo, the face integration clean check using digital smile design idea. Initially, our team is all the time thinking about not only teeth alignment, it's integration, the face and the teeth position. All the time I decide on the final position, then go to the tooth movement, more detailing. Of course, this patient is a 3 days aligner change, expansion and alignment for the, of course, extrusion anterior teeth because this patient is open bite anterior region. So that very difficult to every orthodontist, every doctor, same as this for the very not easy to image for the extrusion. It's possible for the aligner, but already 2010 is a JCO article published from Dr. Bernard Shoup. Anterior open bite is very effective tooth control for the Invisalign system aligners. Based on this article, then I started for this patient the first aligner set with attachment, started to expansion. This photo is 2 months later, expansion, of course 3 days aligner change. Then this photo is 3 months later, and this photo is 4 months. Started to extrusion, the vertical tooth control. This month is the 5th month later. As you can see, the teeth and aligner is every situation is a perfect fitting. Maybe so that many of the doctors think about aligner orthodontic easy to happen, create a posterior open bite, but please have a look. This patient is a posterior region, is good for the vertical contact and not unfitting for the anterior region.
These are amazing results in only 5 months, Kenji.
Thank you, Robert.
It's amazing. So let me ask a question.
Okay.
And I'm sorry, my
problem.
understanding is not very good.
No problem.
But so typical aligner change is 14 days?
So initially, the Align technology recommendation is started time to 1998 is 14 days, 2 weeks. But 2017 or 2016 will be changed. Some doctors, depends on the doctor, is 1 week protocol is possible. 7 days aligner change is normally. But we can do is 3 days aligner change using OrthoPulse device is very faster and more easy to fitting. The patient is very comfortable, and why patient can do swapping aligner 3 days change. That is very important thing. It's painless using photobiomodulation. If pain is more strongly, patient doesn't understood using 3 days aligner change because the patient don't like. Yes, the pain is everybody don't like it. So why can we do 3 days aligner change? Is fitting is better, tooth mobility is good, and painless. That is very important thing. Painless, then we can do 3 days aligner change. This is a
I see. Thank you.
No problem. So 5th month later. Then so the OrthoPulse device, they're using like this for the apps. The patient using the 10 minutes per day for the photobiomodulation. Our app, the checking for the patient compliance data. If patient is good using for the OrthoPulse device every day, as you can see, this patient is a 90% good compliance. Then I give to the patient 10 aligner per month. Then 10 aligner step up per month. That is amazing. 5th month later, this patient's treatment time is finished. If 2 weeks aligner change, this patient have to need 23 months. If 1 week change the aligners, almost 1 year treatment time. But using this device, just 5 months, totally treatment is finished. Very, very important thing, initially planning, this is a final situation for this patient. Total aligner, 46 aligners. You can see this is a comparison initial and the final for the panoramic X-ray. No root resorption. That is very important thing for me. And 3 years retention. Very important thing. Please have a look. This is a 3 years retention for this patient. The midline is correct. The occlusion is good. Canine and first molar is class 1 relationship. And the smiling is good for this patient. Very important thing, initially, the acceleration tooth movement, just 5 months finish, but 36 months, 3 years is stable. Using this device is only acceleration. No, treatment phase is acceleration, retention phase, very, very stable. This is cephalometrics, cephalometrics. This is a good control. Initial, final, 3 years retention is a good control and stable. This is 4 years retention for this patient. 4 years. Very nice. So the smiling and the midline is correct. No relapse, any other teeth. This is 4 years retention. Midline is correct. Class 1 relationship. Canine and the molar is a class 1 good relationship. And the guidance, anterior guidance, canine guidance is good. And no relapse, no happen to anterior open bite. This is initially
amazing.
Thank you. Then 4 years retention is good for the control of tooth using photobiomodulation effect with aligners. This is a comparison initial, final 3 years retention is 4 years retention for this patient. This is the first article for my team. The next one is published on 2020 in March. Very new article. Aligner biomechanics.
So this is only 2 months ago. Wow.
Just 2 months ago. Specialty for
Okay.
our YouTube live. Aligner biomechanics extraction. This article published on our team collaboration. He is legend. He is a superstar in the world. Professor Ravi Nanda from University Connecticut Orthodontic Department.
Ooh.
Class 2 anterior clouding extraction approaching. 26 years old female patient. But this patient problem is after 6 months later, before 6 months wedding ceremony. That is very big ceremony. So they changed the lifetime. Very big event for this patient. This patient comes.
So this was for the initial visit was 6 months before the wedding.
Exactly.
Oh wow. Okay. What pressure? Such pressure.
Yeah, exactly. So I'm deeply pressure, but at this time, so we have already, as you know, so 2016, our team photobiomodulation acceleration device. 2016, so we have experience for the using acceleration approaching. So the patient come to my office. The patient asked to another orthodontic office, 4 different office. But another office orthodontist, they are talking to this patient is impossible. After 6 months, cannot alignment. Only solution is extraction, lateral incisor both of sides, and preparation, and only cosmetic preparation approaching. So the bridge, not orthodontic treatment.
Prosthetics, yeah. Okay.
Yes.
Oh, I see. Okay.
that is not good health and not long-term stability. But
Exactly.
yes, that this patient want to be good smiling because this patient is a very, how I say, want to great smile for the wedding ceremony because already this patient is mom is passed away.
Ah,
Yes, only dad is take care of her. So I
okay.
want to give thanks a lot my dad and thanks a lot mom from the pass away. Then so I want to give I want to so how I support to this patient hope. Then
Yeah, well,
yes I
this is a special mission. This is a very
yes
special mission, Kenji.
thanks a lot. Then so that I explain so the acceleration device. Then so that already this patient are knowing for the photobiomodulation effect because of reading for our article. Then so that usually so that many of the patient may usually I give to the acceleration device is a 1 month later because the first aligner, second aligner we call practice aligners. If patient compliance is good, I will give to the acceleration device photobiomodulation, give to the 1 month later. But as you can see, this patient no time for the wedding ceremony. Then I
Right,
explain
right.
for this patient, if you the good compliance, you can use 20 hours per day wear the liners, and you can do 10 minutes per day for the using the OrthoPulse device. I will give to faster liner because you don't have any time. Then the patient accept 26 years old female patient class 2 molar relationship 1 to 2 to ringer shift high canine severe overjet upper narrow arch 36 not good root filling. Then this is the initial situation for this patient before 6 months wedding. This patient is OPG and cephalometrics. So my planning is this 1424 and 36 extraction. These teeth, upper both of side and first premolars, and the lower 36, as you can see, not good root canal treatment. So I decide on extraction these tooth, then extraction after orthodontic treatment, place on dental implant. This is
Okay, so you're going to extract and then create space and then or keep the space and then put in an implant.
exactly.
I
This
see.
is the
Okay.
initial situation. The midline is a severe deviation. Midline is not good and not smiling this situation. Then so that of course same procedures is a facial midline and this is a deviation anterior teeth. I want to planning the face integration clean check, then how millimeter midline shift is better smiling and how millimeter extrusion alignment anterior teeth is good. Then decide on this position, final position. Then I go into the detailing. This is my detailing clean check, alignment and canine retraction, like this tooth movement for this patient. Now, of course, as you can see, upper molar is a lower molar is a maximum anchorage. Then this is article. JCO 2020 is March. Our team published on this article accelerated extraction treatment with the Invisalign system and photobiomodulation. Our team, me and Chisato Dan, Hitoshi Watanabe, Yuriko Kumagai, and my mentor, my master, Professor Ravi Nanda. So if you have an interesting, please read for our team article. Okay.
Is this the first time you've presented about this article in English?
No. So I
Okay,
lecture.
second or third time.
Yeah,
Okay.
lecture is all over the world, but including article is the first time.
Okay, well, you are very lucky, viewers. If you have any
Yes.
questions, now's the time to ask them.
Yes.
Sorry to slow you down, Kenji. Please
Okay,
continue.
no problem. This is the initial situation. then started extraction, and already you know, so this patient started to the first aligner, placed on the attachment, started to orthopulse device and using elastic. Then 5 months later, this patient is wedding ceremony time. The 5 month later, not completely finished orthodontic treatment. This is the during orthodontic treatment time, but anterior teeth is a good alignment for the midlines correct and a good smiling. Then patient is attending for the wedding ceremony, and the end of the wedding ceremony, continue again orthodontic treatment. Then finally place on dental implant lower left first molar area. Total treatment time 3 days aligner change for the 8 months finish.
Wow.
8 months finish. This is a comparison initial and the final for this patient. Then started to the retention phase. As you can see, this is also phantomograph comparison, no root resorption. The place on the dental implant here. Then this is 2 years retention for this patient. The acceleration tooth movement is very, very faster, but a very important thing is retention phase. This patient, 2 years retention, midlines correct, and the canine and the molar is good for the contact and good for the guidance. This is a 2 years retention for this patient. This is a comparison initial and the final using aligner with photobiomodulation effect.
Oh, that is absolutely amazing. You really helped her realize her dream of perfect wedding, didn't you?
Yeah. Okay, so today's is the 2 cases. If you have any question, please feel ask to me.
Yes, well, ladies and gentlemen, as we said at the beginning of today's presentation, the theme of today's presentation speed, and we saw 2 cases that really speed is possible with aligner orthodontics. There is an impression that orthodontists have that aligners are a slower treatment, the multi-bracket system or methods. That is not the case. As you've seen, you can reduce treatment times by up to, if you have the proper technique, know-how, and devices. Just absolutely incredible.
Thank you.
Okay, Kenji, before we get into everyone's questions, we do have some questions from before and some comments from before. So why don't we have a look at the comments and go through them. So first of all, we already said hi, but Razan and Firas, hello, and thank you for coming.
Hello.
Yes. Spam X4, as you saw, yes, Kenji is able to achieve such amazing results with minimal attachments by using different techniques such as photobiomodulation.
Thank you.
Li Hui Guo says hello. Hello, Li Hui.
Hello, Li Hui.
And Zulu2785. Hello, Zulu.
Zulu. Hello.
Zulu says, are we able to watch this lecture at a later date? And I responded, and I said, yes, we record all of these conversations. They are available on Kenji Ojima's YouTube channel. There is a playlist of all of the YouTube Live international videos, so make sure that you subscribe to the channel so that you can find them easily and share them with your friends. Next, we have Dr. ABD. I'm going to guess this is Abdullah, maybe? Abdullah El-Ghani.
Hello.
Says hello and thanks for the great job. You're very welcome.
Thank you.
And then Li Hui comes with another question. Says Dr. Kenji. Oh, hello again, Li Hui.
Li Hui.
Says Dr. Kenji, does this patient have any? This is the first case. In the first case, do they have any tongue or soft tissue bad habits?
Yes. So many of the open bite patients have any bad habit. So of course, we have to check for the bad habit training. This time is aligner is a specialty the good for the appliance. So normally I use for the some of the open bite patient is just a little bit cut it for the lingual area, only 1 millimeter, 2 millimeter. The patient is touch the tongue. This is not comfortable, very discomfortable. So the easy to tongue position training. I use like this patient for the 1 millimeter cut for the lingual side. That is very, very effective.
Yes, and these cuts you do yourself,
Yes.
correct? You cut these? Yes, that's right. Well, that is a insider's technique, ladies and gentlemen. A free tip from the master for you. Okay, thank you, Li Hui, for your
Thank you.
question. Firas has a question. Hello again, Firas.
Firas.
Firas says, nice result. You didn't use extrusion attachments on the upper centrals?
The case one,
This is
right?
for the first case. Yeah,
Okay.
that's right.
So many of the time is using I definitely explain to yours for the next weeks is Robert and I YouTube channel specialty open bite approaching. But this time is I explain this patient. This patient our category is level 1. Level 1. The level 1 patient is something like no need any the vertical rectangular attachment, horizontal rectangular attachment, only just like this tooth movement is enough. If more than 2 millimeter, 3 millimeter control extrusion, at this time horizontal attachment is a more big side, is more effect. But this patient, no problem. Thank you.
Okay, excellent. Thank you very much, Dr. Firas. Okay, next we have Dr. Elgani again. Hello, Dr. Elgani.
Hello.
And do you use vertical elastic or only attachments?
Case 1, right? No.
Yes.
This patient, no. Because as you can see, this patient all the time is aligner fitting is good. No need any vertical elastic. Only aligner fitting is good and good for the control. But the 3 days aligner change is aligner is catching control.
Yeah, as long as you have the full occlusal face grip, a perfect fit, you don't need elastics or any sort of attachments. I see. Great. Dr. Majid is back. Hello, Dr. Majid.
Majid, hello again.
And he has given us his full name. He says, hello, Kenji and Robert, from Dr. Majid Rashid, president of the Jordanian Orthodontic Society.
Wow.
Well, thank you for joining us, Mr. President.
So the Jordanian Orthodontic Society and the Japanese Orthodontic Society, the both of JOS.
Yeah, that's right.
Yes. JOS friend.
We are brothers, exactly. Okay, well, thank you as always for joining us, Dr. Majid.
Thank you.
Next, we have another question from Firas.
Firas.
Thank you for another question, Firas. Firas says, why do you ask them to use the acceleration for only 10 minutes? Why not more? Does it have any health hazards? This is about photobiomodulation, orthopulse.
So a very nice, very smart question. Thanks a lot, Firas. So the many of the very, how I say, serious Japanese patient is asked to me, can I do twice a time per day or 3 times per day or after meal every time? But research data from research data is 1 time per day or 2 times per day, 3 times per day is same result. It's no needed any more time. Only 1 time per day is enough. But thanks a lot. Wonderful question. 10 minutes.
Okay.
5 minutes
And
upper automatically finish. Then turn to the lower. 5 minutes automatically finish. That is.
Okay. There you go. That's it. Simple.
Very, very simple.
Low pressure and simple. Okay. Thank you very much, Firas. And now we have a question from Dr. Wenhai. Hello again, Dr. Wenhai.
Wenhai.
Says, hello, Dr. Kenji and Robert. In the first case, is there any gingectomy done for the patient?
Mm-hmm.
The gummy smile is gone from the 2nd year to 4th year retention.
Mm-hmm.
So was there any
No. So something like this patient is too much like this, or
I
smiling
see.
position. Yes. The end of the time is this patient is 3 years, too much laughing, but 4 years like this. Yes, maybe sort of smiling position,
More
or
more relaxed,
yeah,
maybe.
I don't know. There's some sort of using the Botox. I don't know, but no. Currently, so many of the female using the Botox like this. I don't know, but only teeth movement. Teeth movement is no intrusion, only retention phase. After after orthodontic treatment, only retention. Thank
Okay.
you.
Thank you very much. Thank you very much, Dr. Wenhai. And he has a final question. Is it possible to intrude the whole upper section with a bone screw?
If you want, yes. Yes.
But not used in this case.
Yes.
I see. Okay.
So
Thank you very much,
maybe
Dr. Wenhai.
3 or 4. So the last our YouTube channel case, I put on the tat and the increase anterior teeth, but this patient didn't know. That if I want to do, I do.
Right. That was episode 9, I believe. That was episode 9, 2 episodes ago. Okay. Next, we have another question from Dr. ABD. Hello again, Dr. ABD.
Hello.
Who says, nice result. In the second case, you used 80 aligners total?
Around
correct?
around yes. Extraction case around 75, 80, less than 90, yes.
Okay, great. Thank you very much.
Because 10 aligner per month, then 8 months finish around 80.
That's right. And because you started with no practice aligner, they started with 10 aligners from the first month, which is rare, right?
Yeah.
That's not typical
Exactly.
of your
Thank
cases. Okay. Thank you very much, Dr. ABD. Next, we have Dr. CMY. Welcome back, CMY.
CFY.
Right. Dr. CMY, welcome back. Amazing cases.
Thank
How
you.
and where do we buy the OrthoPulse device, and how much does it cost?
It depends on the country, but it's very easy to where you can buy for the orthodontic society. And so my approach in how to buy it is going to the AAO, American Orthodontic Society, or something like go to the European Orthodontic Society. Now, where your location CMY, maybe you can buy for in your countries, except Japan. Japan is not yet for the selling, not yet.
Yeah.
So I have
It's
to
very difficult to get medical clearance. That's right.
exactly. So the very very difficult. Then I have to go to the another country, then get myself. But you can do maybe easy to buying.
Good luck, Dr. CMY. I hope you can get it. Next, we have Dr. Li Hui has a comment for you. Hello again, Dr. Li Hui.
Hello.
So Li Hui says, thank you, Dr. Kenji. This is a great idea for open bite patients. Great idea.
Thank you.
Okay, next we have we have a new commenter. I don't think I've
Welcome.
seen this name before.
Christian.
Dr. Christian Reis Lemes. Hello, Dr. Christian. Says, very
Obrigado.
good, Kenji. Obrigado. I am
Obrigado.
Christian from Brazil. What is the frequency of application of the laser for acceleration? How many times each aligner?
Yes, that is very nice for the question. Obrigado, Christian. So this frequency is 850 nanometer light wave. Then so the very, very high safety, not warm, not too strong light wave. Then so where the upper arch 5 minutes, the automatically B, then turn to the lower 5 minutes, then finish. Only this. 5 minutes, finish.
Yep. And so that's every day, correct?
Every day. It's in patient home. Or
Okay, so that means...
patient office.
Okay,
Patient
there you go.
school.
Wherever is convenient, because
Yes.
it's a very small device,
Yes.
right? It's very small. So per aligner, if you have a 3-day aligner change, that's once per day, three times per aligner for the second case result. Okay. Well, thank you for your question. Obrigado, Christian.
Obrigado.
Next, we have Dr. Hello, Dr. Me.
Mino, hello.
Dr. Me says, great cases. Thank you for sharing your knowledge. And thank you for coming out and giving us the opportunity to share our knowledge. We could not do this every week, 2 times a week, if it wasn't for your viewership. Thank you so much.
Thank you.
Okay, Firas has another question here. Very active today, Firas. Hello again.
Fila, come on.
Firas says, what is your retention protocol?
Oh, wonderful, nice question, Filas. So that I usually all the time is a clear liner type for the retention system, except perio case. If perio patient is eye bonded to the Ringo 323, then over the clear retainer. But my suggestion, my opinion is specialty aligner orthodontic patient is good for the compliance for the removable clear retainer, because normally fixed braces patient is around 2 years is a fix. No habit, no routine work is remove myself, insert myself. But please think about for the Invisalign system, please think about aligners. Patient already education for the retention phase. Wear the aligner 20 hours per day. This is normally. Then started for the retention phase. First time 20 hours per day, around 6 months. After that is 18, 15, and 12. Then during night time. This is a very, very good for the retention, specialty aligner orthodontic patient. This is my opinion.
And also, your master, your very respected doctor, Dr. Ravinanda, has said on many occasions that not only are retainers a special extension of aligner cases that are a perfect fit, but also Japanese patients are also a perfect fit for aligner orthodontics, because Japanese patients their compliance is unbelievable, right? So in many countries,
I think so.
I know that many doctors, European doctors especially, have told me that they think that your treatments are unfair because they only have 70-80% compliance in their best patients, and you have between 90 and 100% compliance in all of your patients. So, of course, aligner orthodontics is 50% doctor, 50% patient. You need to have cooperation in order to achieve results, and Japanese people are very good at cooperating. Okay, so thank you again, Dr. Firas, for being so very active.
Firas.
Next, another returning guest. Welcome back, Dr. David Tan.
Welcome, David.
David says, hello, Dr. Kenji and Robert. May I know your opinion on the comparison of photobiostimulation versus Excellident microvibration?
Very nice question. Very nice. So as you know, the Robert and I is 2040 published on the JCO article, Excellident using Invisalign system. That article is Robert and helping to me. Then I use many of the case for the using Excellident, and of course using many of the case OSPAS device. My simple answer, both of good. Both of good. But very depends on the purpose, depends on the situation. The specialty is a photobiomodulation, is target point is gum, as you can see. The Excellident is target point is crown, vibration. Then the crown target is easy to vibration force going to the around root. Okay, but photobiomodulation cover to the gum, going to the gum, okay? This, some of the time, high canine patient, open bite patient is good for the target photobiomodulation. And some of the time, molar distalization time is better to vibration force. It depends on the situation. It depends on the teeth size and the position. So you have to choose. But my opinion is both of good. But very important thing. Which one is more patient friendly? Excellident is 20 minutes per day. Photobiomodulation is half the time, 10 minutes per day. This is different because every day approaching. Very, very important thing for the patient. Another hand, accelerant is vibration. Very tough time is biting 20 minutes because the vibration force like this.
You have to apply force.
Yes, like this.
Right? Yeah.
But the photobiomodulation, not vibration, very silent, only just bite, which is more cool, which is more better to use for the patient. That is totally different. But the effect is depends on the situation, depends on the position. But which one is more friendly for the patient is OrthoPulse is much better, I think.
Okay. Well, thank you, Dr. David, as always, for your wonderful question
David.
and viewership. Okay, next we have Dr. Najib Kabawi. Hello, Dr. Najib.
Najib, hello.
Dr. Najib says, hello, Dr. Kenji, and thanks for a great lecture. About the second case, do you have any difficulties where the aligners were not rigid enough after the extraction of the 14 and 24?
So the liner was not rigid enough. What does mean rigid enough?
It means stiff enough or strong enough. Maybe it was bending or too soft.
Okay. So as you know, for the Invisalign system aligner is the same material, very soft and easy to bind. Not for the different situation, not so the different material is same. Your Invisalign aligner, my aligner is the same because this is a release align technology. Name is Smart Lock. That is amazing one. It's the same. Then so we have to think about biomechanics and the root control for the aligners, then control the same material.
Right. So the material was not a problem because you had proper planning and anchorage control, even with that large space after the extraction.
Yeah.
Okay. Great. Well, thank you very much, Dr. Najib. I hope that was helpful.
Najib, thank you.
Next, Dr. Jingying is back. Hello, Dr. Jingying.
Hello, Zaichen Jingjing.
Dr. says, hello, Dr. Kenji and Robert. For the second case, just wondering if closing the gap of the 36 rather than placing of an implant is possible.
I can do everything, as you can see. But this patient is one thing is 6 months before wedding, and she want to pregnant. So the want to pregnant. So the end of the also immediately after place on the dental implant. This is her hope. Then so now is already she have a cute baby. So if I have a time and she have a time, I can do molar measurization. We can do everything. But at this time, patient want to end over the also immediately after place on the implant. Then I do like this treatment planning. But you are very smart. Yes, if have a time, I can do measurization, wisdom tooth measurization, second molars. Yes.
Okay. Thank you very much, Dr. Jingying, as always.
Thank you, Jinji.
Next, we have Dr. Fiona. Fiona is back. Hello again, Fiona.
Hello, Fiona.
Dr. Fiona says, hi, Dr. Kenji and Robert. Amazing how these cases can be finished in such a short time. Can the OrthoPulse device be reused for another patient, or is it single use only?
Single patient only, of course. Yes, this is every patient is changed. Yes, of course. So
there we go. So one patient, one device,
yes.
And then you don't use the same device for the different patient, right?
But very nice question. Great. Very important thing. Important.
Well, Fiona. Of course, it's depending on the patient's situation, right? If the patient doesn't have enough money to buy an OrthoPulse device, being able to lease it, if that is possible, is an attractive idea. But of course, that is not something that Dr. Kenji does. Okay.
Change.
Thank you for your question, Fiona. Yeah, change. Okay, next we have Dr. Naeem. Hello, Dr. Naeem.
Name, hello.
Says, hello, Dr. Kenji. Amazing cases as always.
Thank you.
Do you have any suggestions on attachments or overcorrection techniques in Invisalign for getting the super finishes that you achieve?
Thanks a lot, Naeem. So if you need it for the overcorrection time, so want to more control of the root, the control of the position, at this time, small attachment is very effective. But now I don't any placing, so the small attachment, but about 10 years before, at this time I just put on a small attachment and the retention phase, just controlling for the root control. But now I don't do that. But if you want, please additional small attachment for the retention phase. That is very effective. You are right.
Thank you very much, Dr. Naeem.
Naeem.
Next, we have Dr. Mahesh Gonde. Hello, Dr. Mahesh.
Mahesh, hello.
Says, hello, Dr. O and Dr. R. Awesome outcome in such a short time. Do you slow down the velocity of tooth movement, meaning more aligners?
Nazim, you are very smart. So that I many times are talking about this YouTube channel, but a long time ago, 2012, 2010, around this time, sometime the tooth movement velocity is very low, something like one aligner 0.125 millimeter control, normally 0.25 millimeter one aligner each. But now is every single aligner is normal speed nowadays. But if you don't have any experience and if you want to more control precisely, specialty more control at this time, if you want, you can do more slowing down velocity, something like one aligner 0.125 millimeters. Now, no. This case, no.
Thank you very much, Dr. Mahesh.
Thank you, Mahesh.
Okay, next we have Dr. Lin. Hello, Dr. Lin.
Hello, Lin.
Dr. Lin says, hello, Dr. Kenji and Robert. Thank you for your wonderful cases.
Thank you.
It's a pleasure as always, Dr. Lin. Do you only correct premolar rotations after anterior intrusion or extrusion is completed, or do you correct them simultaneously?
So this Dr. Liu question is case 2, right?
I believe so, yeah.
Premolar rotation after anterior intrusion, extrusion completely, or do you correct them simultaneously? Okay, so that normally is I definitely recommendation is what is digital orthodontic? What is, how I say, behind digital orthodontics 3? Digital orthodontics is that you can divide every single tooth movement. If for the braces, this is the fix, bonding, braces, aligner. You can divide everything. Simultaneously is the same as analog approaching, ideal analog tooth movement. If you using digital orthodontics system, you can divide every single tooth. Is more correct, more predictably. I definitely case 2 is not simultaneous. It's divide sequential tooth movement. Thank you.
Thank you very much, Dr. Lin. Okay, next we have Dr. Sumida. Hello, Dr. Sumida.
先生どうもありがとうございます。
Dr. Sumida says, good evening. Thank you very much. If the patient had more time, did you close the space between the 35 and 37?
35, 30, 右下、yes. If patient have a time, I can do for the molar measurization 37, 38, yes.
Great, thank you.
ありがとうございます。
Okay. いつもありがとうございます。
ありがとうございます。
Okay, next we have Dr. Edgard Irani. Hello, Dr. Edgard.
Hello, Edgard.
Dr. Edgard says, is it possible to use photobiomodulation only on the areas we need to move and not on the anchor teeth for more anchorage control?
You're very, very, very cool. Edgar. Okay, I will show you my article. Okay? Can you see that? This article? So, okay. Please read more. This is better. You are right. For the orthopath device is not big size. Orthopath device normally cover to premolars. Okay, then so that this patient are using normal position. If normal position only cover to premolars, you are right. So that as you can see this article, first molar, second molar, third molar is not effective area. This is not for the effect photobiomodulation. This is a bone, is a root, is a normally. But using anterior region, this is an effective area. This is an acceleration tooth movement is possible. This is a totally different. The molar side is more strongly anchorage, easy to control premolar canine area. You are right. If you have a reading this article, you are more understood. But you are very, very nice. Very nice. This is the point of the view approaching.
Excellent question, Dr. Edgar. Thank you. Thank you.
Thank you.
Okay, next we have a comment from Jingying. Jingying says, thank you so much, Dr. Kenji and Dr. Robert. You're very welcome.
Thank you, Jim.
Okay, next we have a returning guest, Dr. Cisco Fidel. Hello, Dr. Cisco.
Hello, Cisco.
Dr. Cisco says, thanks, Master. Distalization for lower molars done using Invisalign alone? If yes, what technique is used there?
Yeah. Cisco is I can do is a lower molar distalization is if have a time is next session I will explain for the lower molar distalization is aligners. I promise.
Okay, marvelous. Thank you very much, Dr. Cisco.
Thank you.
Dr. Razan has come back to say, thank you again, beautiful results. Thank you, Dr. Razan.
Thank you, Razan. Thank you.
And Naeem has come back again. Dr. Naeem has come back to say, thank you for your answer, Dr. Kenji. It takes a big heart to take time out to share your knowledge. Kudos.
Thank you.
This is really, in dark times like this, you have to fill the world with light. And filling the world with knowledge is one way to fill the world with light. And we're glad that you appreciate our mission. Thank you very much, Dr. Naeem. And Dr. Christian Lemes is back with another comment. Hello again, Dr. Christian.
Obrigado, Christian.
Christian says, Kenji, thank you for the reply. If you apply the low-frequency laser at the clinic at work once a week, for example, for a longer application time, once a week, do you think, would that be sufficient?
So every 24 hours per day is a continuous effect. If once a time per week is maybe not effect. Because this is according to the basic research. I definitely recommendation every day. Obrigado.
Okay. And just a couple more before we sign off. Dr. Sumida comes back and says, thank you so much. Your technique is always amazing.
先生、ありがとうございます。ありがとうございます。
Dr. Lin says, thank you. And just wondering, do you have any mandibular advancement cases?
No.
No. Very simple. Okay. And then Dr. ABD, our final question of the evening. Can we do mesialization for the group of teeth together or each tooth separately?
So I already told you for the specialty digital orthodontic is a divide tooth movement is more predictably tooth movement. If at the same time is idea from analog approaching. if you can using for the digital device is a separation tooth movement is more safety and a good control. I definitely recommendation. Thank you.
Okay, thank you, Dr. ABD. And we have one more question right down at the end of the show from Kanan Dental Surgery PTE Limited. Hello, Kanan Dental Surgery. They say, thank you, Dr. Kenji. As always, beautiful cases. How do you measure on the CBCT how much we can expand if there's a measured bone thickness of bone from the root to the tooth of the buccal bone is only 1 millimeter?
Yeah, that is very nice question. So the very easy to way is we have to calculate how millimeter expansion or not. That is easy way is cone beam CT and integration STL data, then planning. This is the easy way, okay? So the only control DICOM data, STL data, integration, then we can understand how millimeter tooth control. If without any DICOM data, cannot do that. Very important thing is take a cone beam CT, DICOM data, STL data, teeth data, integration, then you have to searching how millimeter or how degree is possible or not. That is very important thing. Thank you.
Well, wonderful. Thank you so much for the question, Dr. Kanan, and thank you all for coming out and joining us once again for another very active, successful, fun, and informative Kenji Ojima YouTube Live International. Ladies and gentlemen, you are amazing. Without you, we could not continue to do this. Now, usually we would have our next show on Wednesday because we are on a Saturday-Wednesday schedule. But this week, there is a scheduling conflict. There's a scheduling conflict on Wednesday. Kenji, what is happening on Wednesday?
Yes, for the this is the unfortunately so the I and Robert for the every twice a time per week for the YouTube Live internationally. But my mentor, my master, Professor Ravi Nanda, it will be held is a webinar. So the Zoom lecture is the next Wednesday, the same time. So please, everybody watching this Zoom lecture, then so that go back to the next Saturday. I will explain more deeply, explain to this session. And of course, this session, Professor Ravinanda talking about for the aligner orthodontics. So with my research data, that is very good for the yours. Okay, so please check this webinar Zoom lecture from Professor Ravinanda. The same time Wednesday, same time. So the Japanese time is 9 p.m. and the European time is 1 p.m. Right? Don't miss it. Thank you.
That's right. Check it out. And you heard it here first. We are going to be, we'll miss you on Wednesday, but the following Saturday, we're going to be doing an extension, a deeper dive into the details of the case that is going to be presented in Dr. Nanda's webinar Zoom session. This is these data, and Kenji will be sharing all of the secrets of the case and all of the techniques. So after watching Dr. Nanda's presentation, think of your questions, write them down, and bring them to us next. What is the date next Saturday? Next Saturday is the 30th, May 30th. So we will see you all next week on Saturday. Everyone, please be safe. Take care. Things are improving around the world, but be patient and be safe. And maybe we'll see you on Wednesday at Dr. Nanda's presentation. And if we don't, then we will definitely see you on May 30th at our next YouTube Live International. Kenji, do you have anything to say to our guests before we sign off?
Thanks a lot for all of our friends and colleagues, and thanks a lot again, Robert. And we will see you for the next Saturday. Bye-bye.
Take care.
Take care. Ciao.